I would like to pay my respects to my elders past and present, and elders of different nations. I would like to acknowledge you who are watching this video today and pay my respects to your ancestors and families. May Bunjil, my Creator, surround you and keep you all safe on country. And on behalf of my elders, I say Waminjika, Wurundjeri Balaki Mungundibik, which means you're most welcome to the home of Wurundjeri country. And I wish to welcome you all from the tops of the trees to the roots in the ground, because when you look after the country will look after you.
Acknowledgement of country and welcome to country recognises the unique position of Aboriginal people in Australian culture and history. Country to Aboriginal people means the area we grew up on or belong to, not the whole country of Australia. Melbourne Health is on the land of the Kulin Nation, which is made up of 5 tribes: the Bunurong, Wurundjeri, Tangarong, Dja Dja Wurrung and Wathaurong. Wurundjeri are the traditional owners of Melbourne and surrounding suburbs. The Royal Melbourne Hospital sits here on Wurundjeri land. Someone we know, or maybe ourselves, might be admitted to hospital at some time in our life. This DVD will help to explain some of the things you can expect when you come to the hospital. Some of the questions you may be asked on arrival about your medical history are: do you have asthma or any breathing problems? Do you smoke? Do you have diabetes? And if so, what type? Are you on any medication?
Hi Jack, my name's Marvi. I'm the ward clerk here. I just wanted to confirm a few of your details for our registration page, if that's all right.
Yeah.
Your full name?
Jack Charles.
Jack Charles.
Yeah.
And are you of Aboriginal or Torres Strait Islander origin?
Yes, Aboriginal.
Yes. Could I also get your local doctor or your healthcare worker?
Niles Query, John Cook at VAS, Victorian Aboriginal Health Service.
This will all help if they need to call for your medical records. So now you're in the hospital system. You'll be looked after by many people. So the more information they have, the easier it will be. It's like putting together pieces of a puzzle. Why do hospital staff ask patients if they identify as Aboriginal or Torres Strait Islander?
Australia's multicultural, and it's harder and harder to guess someone's background in everyday life. So unless you actually ask the question, you will never really know.
If there is a culturally specific service available to Aboriginal and Torres Strait Islander people, like an Aboriginal service development worker, this worker can help the staff provide culturally safe care to you during your stay. And they may come and see you if you'd like.
Hey Uncle.
Hey Doc, how are you?
Glenn Harrison.
Glenn Harrison, eh?
Yeah.
Oh, pleased to meet you, Doc. You related to Harrison, Ollie Harrison?
Yep, most likely. Yeah. Robert Harrison's my dad.
Oh, well, Ollie was my mum's sister.
Oh, yeah.
Also, the Department of Health requires all hospitals to collect data on the Aboriginal and Torres Strait Islander status of every person admitted to a Victorian hospital or attending an emergency department. It's important for staff to know this, as they will bring it to the Aboriginal Service Development workers' attention. The Aboriginal service worker is of Aboriginal and or Torres Strait Islander descent, and their role is to help the hospital staff to provide culturally appropriate care.
I think having an Aboriginal person in the hospital is a key to the community, especially on admissions. People look for the Aboriginal face in the hospital. And also on discharge is knowing your services that are connected to that person, whether it be metropolitan or from a rural setting.
The Aboriginal Service Development Worker's role is that of a cultural interpreter, consultant and advocate.
So the role is really to provide a service to
patients and to the staff, so there's an understanding, and to provide a link between community services.
They work alongside other hospital staff to assist and support Aboriginal and Torres Strait Islander patients and community-controlled organisations to effectively use the services that are available to assess, provide, plan and coordinate patient care. This worker is available from 9 to 5 weekdays.
How you going?
Right.
Yeah. How are you?
Good.
Sorry to hear you're in here.
People don't always like coming to hospital, but sometimes things happen and you can't avoid it. The Royal Melbourne Hospital is made up of many different areas.
What we're going to do today is we're just going to test your blood sugar. It's important that we keep an eye on the readings, so we'll be testing it quite frequently. Okay, and that will give us an indication of how to treat it.
Just a little prick.
Ooh.
Not too bad.
Oh, that's not bad.
That's all right.
Nice to see it's still red.
There we go. And that just takes the blood. 5.1. And that's perfect.
That's good.
That's good.
Good afternoon, Uncle Jack, is it?
Yeah, mate, yeah.
My name's Ashley, I'm a dietitian at the hospital here. Well, the last thing we want to see you is in hospital because we want to make sure we can manage your diabetes properly and prevent you from having these types of falls.
Yeah.
So looking after your diabetes can become important. An important part of that is making sure you're eating regular meals. So you don't usually eat after 6 o'clock.
Oh, no.
Can you touch your shoulder?
Yeah.
A bit sore, but
No, that's right.
On discharge, the staff are required to do a care plan with you. This may involve having a family meeting or meeting with your healthcare worker to make sure things are in place, but not always. When it comes time for your discharge, some of the things you may be asked are things like who's at home with you and who's looking after you.
Now, inside your apartment, are there any steps in there, or is it level?
No.
Right, great. And what about in the bathroom? Is the shower over the tub, or is it a separate shower recess?
Separate shower.
This information will help if you're required to use a wheelchair, frame or stick when you get home. You may be asked to show staff you can make a cup of tea or a sandwich. This will help determine if you need extra help at home or home visits. The staff want to make sure they're sending you home to a safe place. With your follow-up appointments, the hospital will try their best for an Aboriginal and Torres Strait Islander specific person, if suitable and available. The Aboriginal Service Development Worker might not always be here, but it's still important to tell staff of your Aboriginal and/or Torres Strait Islander background. People don't always like coming to hospital, but sometimes things happen and you can't avoid it. If you tell us you are Aboriginal or Torres Strait Islander, this will help us provide culturally safe hospital care and follow-up care. The staff at Royal Melbourne Health want to do the right thing by you, and we know that Aboriginal health is everybody's responsibility.